at the World Health Organization meeting being held in Islamabad, Pakistan, polio was really the front line. Everybody's talking how to get rid of polio, polio eradication. The whole world now, only Pakistan, Afghanistan, and Nigeria remain. We're fortunate to have with us the manager of the polio eradication program, Chris Maher. Welcome.
Thanks very much.
What will it take? There has been a lot of progress, especially in the past year in Pakistan and Afghanistan. What do you think, Chris, is needed to make it happen so that we can say we are rid of polio?
I think the most important thing to understand about eradicating polio is that it's not a big breakthrough kind of a program. It really is attritional. It's hard work. It's making sure that every child throughout each infected country is fully immunized, receiving vaccine on a regular basis, that surveillance stretches everywhere. So
it's a very long, difficult
and difficult process, and has a lot to do actually with equity and with ensuring that all communities receive equal services.
And in these two countries, you have a lot of problems with access in some places.
Yes, I mean, both countries have suffered through periods where accessing all children was very difficult because of security reasons. Pakistan at the moment has a much better situation than it's had for a long time. In Afghanistan, while the situation's improving, we still struggle to reach all kids in every campaign.
So have you depended a lot on the vaccinators themselves, and have you had problems with health teams in different areas?
I mean, absolutely, we're very dependent on the vaccinators and the supervisors. And what's happened in the life of the program is that increasingly the vaccinators coming from local areas and being parts of local communities has assumed more and more importance. So now it's very, very important in obtaining access.
Are there ways of rewarding these people? Because they're the real soldiers in the battle against polio. They are always there at the front lines in the most difficult situations. Are they being acknowledged sufficiently? I mean,
we certainly try very, very hard to acknowledge them. I think the people who work on polio in the field, 99% of the vaccinators and the supervisors and whatever are doing it because of an honest belief that they want to do something.
Want to help.
So, I mean, that's one of the sort of golden.
I think the public in general don't understand how difficult it is to keep the vaccine cold enough to make it to reach every person in every place in the world. And for the countries that have already eradicated polio, they still have to go on vaccinating.
Yeah. Because we're dealing with a living creature, a living organism, polio virus, and it's not passive. It doesn't sit quietly. It needs to be able to infect people and move around to stay alive. So it's always a risk.
My last question is, in your opinion, when do you foresee this happening? I mean, with the situation as we are now, with the difficulties we are encountering, when do you foresee it happening?
I think that the next low transmission season, that's the period between November, December and say May in 2018, this period is the crucial one. We really could stop transmission completely during that period of time.
Thank you. So this is the crucial period. Everybody working in the field has to really work as a team to be able to get to each and every one with the polio vaccine. And you, the public, please don't hesitate. Go to the vaccination centers, and many of them are mobile units that will come to you.